adult BLS stuff. Um, the quiz is only 10 questions. My like this one have 9. But it's not hard. It's all stuff that we've gone over. So okay. This thing. All right, so this is this high quality adult CPR.
Foundational
All this stuff sorry, it's been a bad afternoon. All this stuff we already, like, y'all have already gone over, so it's just kind of gonna be a review, because we've actually done adult CPR, but this is just like the words that goes with the videos. When you do it properly, it only supplies about 30% of the normal blood flow needed by the brain. So in order to deliver the best outcome, you should focus on always providing high quality CPR. So we know what high quality CPR is. That's doing pushing hard and fast in the center of the chest, 100 to 120 beats per minute. That's one of your bell ring questions. Giving good breaths, making sure that you get good chest rise as you're giving breaths, making sure you have a good seal. If you need to reposition the head, then you need to do so in order to get good breaths.
Concept 1.
He said push for 120 meters. 100 to 120 beats per minute. So when you're doing compression, that's how fast you need to go, 100 to 120 beats per minute. So we know our first concept is to start with chest compression. So within 10 seconds of recognizing cardiac arrest, if possible, because the longer that you're without blood going to the brain, or blood flowing and oxygen going to the brain, that people can get brain damage or possibly die. So it's important to do CPR as soon as possible.
Concept 2. Chest.
All right, so the second concept is that your compression needs to be hard and fast on the lower half of the sternum. That's one of y'all bell ring questions. So for adults, each compression needs to move the chest at least 2 inches or 5 centimeters. That's how far you need to go with your chest compression. So you do this in order to produce a good blood flow. So chest compressions need to be fast. So they need to be at least 100 compressions per minute. So that's how fast you're going to compress. 120 is like the max. So you go 100 to 120. That's how fast. Between those two numbers, you should be good with your chest compression. High quality CPR. Because once you keep going, you can get tired if you don't get a break, and your compressions won't be as effective. And you don't need to try to go faster than 120 because they won't be as effective. Because trying to go really fast is not going to be beneficial.
Concept 3.
All right, so as you're doing chest compressions, you need your chest to completely recoil. A complete recoil allows blood to flow into the heart, a biological process known as venous return. So recoil is you press down, when you come back up, that's your chest recoiling. That's what that means. It provides the most blood to be pumped during the next compression. You should avoid placing any pressure on the victim's chest during recoil, because this impedes the venous return and it decreases the blood flow. You want the blood to flow. We don't need it to be decreased, because if they're in cardiac arrest, it's already not flowing. So we want to try to increase blood flow.
Concept 4. Minimize
y'all know this. Rescuers should limit interruptions to chest compressions. For example, delivering the required rescue breaths within 10 seconds. So when you're giving your 2 breaths, it shouldn't take no longer than 10 seconds, because you want to get back to your chest compressions as soon as possible. You said 2? Yep. Hello? I'm calling you in the office. Okay. Okay. I'll go back to the office right back. Hey, yes, you don't want to, 10 seconds is all, like you do your chest compressions, you give your 2 breaths. That shouldn't take longer than 10 seconds to give your 2 breaths. Right back.
Concept 5.
All right. Rescue breath should be delivered over 1 second and provide enough volume to make the chest rise. So you're giving 2 breaths over 1 second, so that's 2 seconds. Rescue breaths fill the lungs with air, including oxygen. When blood circulates through the lungs due to chest compressions, it absorbs this oxygen, which is needed by the brain.
Concept 6. Avoid excessive ventilation.
You don't want to overventilate. You don't want to give them too much air. It can cause gastric, stomach inflation, and resulting complications such as regurgitation and aspiration. They start throwing up because you're putting air into their stomach. You can aspirate. That means that throw up, whatever they vomited, will go down into the trachea and down into the lungs. And you don't want anything other than air in your lungs.
You can have the same thing for babies, like they get done about them.
Yeah, that's why you gotta have them like kind of propped up when you feed them, because if they're not laying the right way, then that food can go down into their lungs. Also, excessive ventilation can cause the lungs to expand and increase interthoracic pressure. This can decrease venous return to the heart during recoil.
Procedure for performing high.
All right, so we all know this already, but these are the steps you're going to position the victim. So that means they need to be supine. Remember, that means on their back. You're going to prepare for your chest compressions. You're going to give 30 compressions, 2 breaths. With 2 rescuers, you're going to switch compression rolls every 2 minutes. You're going to continue CPR until it's appropriate to stop.
So do all this for 10 minutes in the house?
No. So if you have your AED and you're doing 30 compressions, 2 breaths, you can switch every 2 minutes. You normally will switch if you have your AED on when you get ready to analyze and all that stuff. And shock, that's usually about 2 minutes. So y'all can switch while all that's going on. Switch positions. So it's not really 10 minutes. It's
just until they wake up or
until they get a pulse, somebody pronounce them dead, or stuff like that. But you'll keep going.
Step 1. Position.
All right, so just make sure they're on their back. I told y'all about they need to be on a firm surface. The bed. So the backboard comes out off the bed, so you can roll them, and you can usually it's like a board. I don't have one of those boards. Sometimes you can use the headboard. I don't have, but it's a little board that you can put like your roller put under them. So you will take this off. Sometimes they shape more. This one is not shaped the right way, so you can't use this one. But this shape more smaller, and you'll just roll your patient, like roll them over here, like roll them, and then you'll stuff the board under them, because it needs to be firm. Because these are mattresses. Now they have like this bed has a CPR drop, where it'll drop the bed, and some of the newer bed it has a thing where it makes the mattress like firm. So it's not, how a mattress is soft. It'll make it like hard. It'll harden the mattress so you can do CPR that way. So if they're on a bed, you want to move them to the floor. You want to make sure the victim is in the supine position, so that's on their back. If needed, you can roll the patient over. In all cases, if you suspect a spinal injury, try to keep the head, neck, and torso aligned when moving or rolling the victim.
Step 2. Prepare for chest compression.
All right, so we know chest compressions. You're gonna position yourself at the side, because on the side you do better chest compressions. And also the person that's giving breath is gonna be at the head. So it doesn't really matter which side you get on. A lot of times most people get on the left side because that's where the heart is. So you put the heel, one hand in the center of the chest over the lower half of the sternum. I know that is on your quiz. It's the lower half of the sternum. Your hands, like somebody last period put fingers, it's gonna be your hands.
It's like when you put your hand on the sternum, like it's gonna be like right here.
It's like, so this middle is your sternum. Right. So you want to put your hand on the lower half of the sternum, and then you'll make sure your arms, your shoulders are over your hands, and you want to push straight down. You don't want to bend your arms. that's why, like, we have stools. Some people get on the bed. They'll like kneel on the side of the bed so you can get good, leverage. Cause y'all know y'all working with the tables is hard. Normally we get on the floor, but we're not getting on the floor. It's COVID, so. But that's better because you got you can press better like that. But yeah, that's a question on your quiz. I didn't remember that part. So it'll be the lower half of the sternum with the heel of your hand.
Step 3.
You'll give chest compressions. Lower half of the sternum. That's the answer to one of the bell ring questions. So you'll perform chest compression by pushing straight down. It allows you to use your body weight instead of your arms. So that's going to conserve energy. So we know it's 2 inches or 5 centimeters that you need to press down on your adult patient. It's different with pediatrics. So we talked about compressions. Make sure you release it. That's your recoil. You don't put any pressure on it while it's recoiling. So kind of like it's bouncing back up like that.
It's also good for you to get your recoil bouncing for the patient.
Yeah. You'll provide 30 chest compression at a rate of 100 to 120. So that's, I think, number 5 maybe or something. So 100 to 120. So. All right.
That's the mouth. The pocket.
The pocket mask.
Yeah.
I know they missed this question they were missing this question on the quiz. So you're gonna make sure that you seal the mask on the victim's face, and simultaneously you're gonna open the airway using the head tilt chin lift. So remember, this is your head tilt chin lift. Head tilt chin lift. And so when you let's see.
The other one called a paper bag, right?
Called a what?
It's called that one called a pocket, but that other one called a bag something.
Oh, bag mask. Bag valve mask. Right. And what they missed on that quiz was.
What's that called again, Ken?
It's a bag valve mask. I call it an ambu bag.
But in the what if I PowerPoint said bag?
Yeah, like ambu is the kind of like the name brand, like who makes it. So we just say ambu bag because it's easier to say than bag. Some people might call it BMB though. They like to. But like when you got this mask on, this is what they were missing. I think the quiz asked them, what does it cover? It covers just the nose and mouth. They was picking nose, mouth, and chin, or something with the chin.
It's the nose and the mouth.
Yeah, it covers the nose and the mouth. Now, some of them, it's on the chin, but technically, depending on how big your patient's face is, it might not cover the chin.
But it's all cover the nose and the mouth.
Yeah, you're looking at a mannequin, it's gonna cover all of this, but it's the nose and the mouth. Because remember, your fingers are under the chin. These 3 fingers trying to hold the seal. So that's another question. That's the one they missed. And they also missed, I think if you're trying to give air, something about you have to reposition. Like if you don't see like air movement, like if you're trying to give breath and you don't see any chest rise, then what would you do? You're gonna reposition.
Right.
Because you could not have the head tilt, chin lift might not be.
You should always have the head tilt.
Yeah, if I'm giving breath and I don't see anything, that's even if I'm bagging. If I'm bagging this patient and I don't see the chest rise, what y'all saw me do the other day. If I'm going like this and I don't see anything, I'm gonna reposition. I might tilt back a little bit. I'm gonna try to get a seal, and then I'm gonna bag them. So you gonna reposition. If you don't see anything going on, you reposition to make sure you got air going in.
Right. But you're not gonna just keep it there because clearly ain't no air going in.
Right. I don't forgot what they picked, but it was wrong. Whatever it was. My name was Hot Mad, but.
Step 5.
They was trying to negotiate, but it didn't work. All right. So when you have 2 rescuers, you're gonna switch compression rolls every 2 minutes, or that's 5 cycles of 30 to 2. So that helps you not to get tired, especially the person that's doing compressions. So of course, everything needs to take less than 10 seconds because you need to get back to your compressions.
You said 5 cycles. You said 50. What you said?
5 cycles. So if you're doing 2 minutes, normally if you do 30 to 2, 5 times, that's gonna be about 2 minutes. So that's 5 cycles of the 30 to 2.
Step 6.
So So this is another thing. You're going to keep doing CPR until it is appropriate to stop. So things that make it appropriate to stop, an AED shows up, which, AED is going to analyze. It's the only time you're going to stop, the compressions when it's analyzing. Victim shows signs of, y'all remember what it stands for, Ross? Return of spontaneous circulation. So there's coughing, they start coughing, they start breathing, or they're moving, purposeful moving, not just like little, jerks for, not purposeful. So that's another reason you will stop your high quality CPR. If the EMS, so if you're out somewhere and you had to start CPR and you had to call 911 and people show up, you're going to transfer it over to them. They're going to take over. So you'll stop.
I thought we went to like a facility or something.
No. If you're out somewhere and they come, then they're going to take over. So you'll stop. That's the only way you'll stop is in it. Take over. Rescuers aren't able to continue because of exhaustion or the scene becomes safe. So like if you're by yourself and you're just going on and on, nobody showed up, you're out in the middle of nowhere, and you're just tired, like you can't go on because the longer you do it, the more tired you're going to be, and there's a possibility that you're not giving good compressions anyway if you're tired. Or they bring a document that says that they don't want all this stuff, so a DNR. Because like when we in the hospital, they would bring people, older people, not just older people, but people from the nursing home or came from home. We're not going to be like, oh, they look old, we ain't going to do nothing. We're going to do what we can. We're going to try to save them until this shows up. Until they
way back up before then.
They're just gonna be heart ticking. It's gonna be like, well, we can't just not do anything.
I'm talking like the doctors, like they come here, there's nothing that you can do because you don't know.
Yeah. So we're gonna try to save your life if we can, and if they come later, because if it's happened, they on the ventilator. I mean, they got a heartbeat, they're alive, just they're not breathing on their own. And then they'll be like, well, the daughter came from New Zealand and she has a DNR order. Well, we in Georgia and we ain't have that, so we pumped my mama's chest. Now she back. So that's just, you know what I'm saying. But if they show up with it, we'll stop and they say, hey, she's a DNR.
We'll tell you that before me.
Yeah. So if we don't know, we actually have people that have like DNR tattooed on their chest and stuff. We don't take that as that's not a legal document, but they had like people come in with it, because they be like, hey, don't be pushing on my chest.
And then you do that, no doubt.
Right. All right.
Rescue breathing and barrier devices.
All right. So rescue breaths require proper technique, just like chest compressions. So we're gonna use a barrier device. That's the pocket mask. That's the little face shield I showed y'all. If you don't have anything, don't worry about it. Don't put your mouth on nobody. I would tell you that pre-COVID, like unless you like know them, y'all family, y'all cool like that.
When
like
you're in the hospital, you're gonna do that.
Yeah, if you're in the hospital, you're gonna use that right there. So a barrier device is used to protect the rescuer from, so it's protecting you if you're trying to save a life from anything the person might have, any of their exhale air, fluids, like saliva, vomit, or blood. So we got the pocket mask, and then you got the bag mask. They are different. They come in different sizes for adults, children, and infants. They have little bitty ones for the babies. So you need to make sure you use the right one.
But for a little bit, like new ones, you can use your hands.
That's for the compressions, yes, your fingers.
You can use a little small for like new ones.
So the mask should cover the victim's nose and mouth. It's on your quiz, without covering the eyes or going past the chin. They want to argue with me about this, but it was in there. I said I sent y'all the notes.
Why you do this? Think about it.
Yeah. Well, if we on I said, you looking at a mannequin. The mannequin face is just a mannequin face. And the mask is just a mask.
You don't really need to do nothing to the chin.
So. Yeah. All right.
Using a pocket mask. When there is one
So when there's one rescuer, so if you're by yourself, it's best to use a pocket mask. It's easier to switch between chest compressions and rescue breaths using a pocket mask. That's as opposed to trying to do mouth to mouth, because you could just pop the mask on top. It's mouth to mouth. You gotta pinch the nose, put your mouth on. You gotta do all that stuff if you're doing mouth to mouth. Yeah. So like I showed y'all, you got the C. I don't think any of this on the quiz. The CE with your fingers on the mat, on the when you hold it into place, because you gotta make sure that you got a good seal.
4. Perform a head.
So you're gonna make sure you do the head tilt chin lift because you have to open the airway so that the air is going down into the lungs. You want good chest movement. Okay, I think this is on there. Because you want to give 2 rescue breaths, each lasting about 1 second and causing the victim's chest to rise. So you want to make sure that you got, because you're looking as you're giving breaths to see if his chest rising. No more than 10 seconds giving the breaths because you need to get back to your chest compressions.
Using a bag mask.
All right. When you usually use a bag mask like this device or BBM, BMB, whatever it's called, it can deliver oxygen to the patient. So that this cord here that comes off it goes to oxygen. So that's why you'll see it.
When you looked up in the hospital, you had that popped up.
Or they'll have it. If they bring an ambulance, they have like a little portable one, and they can hook it up there. So you'll place it over the victim's nose and mouth. You'll use the EC technique to hold the mask in place. So remember, I showed you this. This is your C, and these 3 fingers are your E, because it's holding it like on the chin to keep a seal.
4. Perform a head tilt chin lift.
So you're going to perform the head tilt chin lift with the fingers that form the E on the hand holding the mask to open the airway and press firmly and completely around the mask to create a seal against the victim's face. You'll squeeze the bag about halfway to deliver a smooth rescue breath that lasts about 1 second and makes the chest rise. Release the bag when done. Of course, you're giving 2 rescue breaths. You're going to do it less than 10 seconds.
Using a bag mask with
There's 3 or more people. That's not on there.
rescue breathing without.
This is rescue breathing. I don't advise it, especially not now. But if just make sure you're doing chest compressions until somebody can get there. But they say it's minimal. But I still went for it.
What is it? The rescue? I read them.
Yeah, I still.
I like if you can get the real.
Nope, not me. So, but I say if that's what y'all want to do.
Lesson summary. During the.
All right. I don't think this is anything for AD.
What you'll learn. In this lesson, you'll learn.
I don't think it's nothing on AD, but AD. We talked about what an AD is.
What is an AED?
So it's a portable device. It delivers a shock during which 2 shockable rhythms?
Ventricular tachycardia and ventricular fibrillation.
VTach and VFib. So you got ventricular fibrillation or ventricular tachycardia. What's the one that's not gonna get shocked? Asystole. Asystole. So it'll shock for these 2. Asystole, it'll tell you to resume CPR.
Because it's flatline.
Using
an AED for adults.
So like I told you before, they come with pads. They come in pediatric, and we'll talk about pediatric next week, but they come with adult pads and pediatric. You can use adult pads on an adult. You can use them on kids, but you got to be careful that they don't touch. It says 8 and up here.
I think with like 12 and up. On another 12 to 14.
I think the actual AHA thing says something different, but
when they do boys, I haven't heard the girls going to do the.
Oh yeah, that's to consider an adult. But when you're using an AED, they say 8 and up. Only thing is if you don't have any pediatric pads and you have a pediatric patient and all you have are adult pads, you can use them. But you just gotta make sure they don't touch. Huh?
You can only use one of them?
No, you can use both of them. You just gotta make sure they don't touch.
You don't think
because they little, so the pads, so these are made to go on a big person. But if you got somebody that's little, they might overlap. You know what I'm saying? Because the body is smaller.
Yeah, that's what I'm saying.
But you don't want them to touch.
Too much for them?
You can use. They say to use both. You just make sure they don't touch. If they touch, that's gonna be too much.
Oh, like both of the pads.
Yeah, if the pads touch.
Oh yeah, I thought so. You put them. You put them on that back and right up.
You can't use the pediatric ones on an adult though, because it's not gonna be enough.
You want to use the adult thing.
Right. So what do y'all remember about the AD? What's the first thing you need to do with it?
Put it on.
Put it on. Once you turn it on, it's gonna tell you what to do. Yep.
Step 1.
We went over all this before. Turn it on. You know, the second person, one person is doing this one is setting it up. You got to work around the person that's compressing because you don't want to interrupt. And then, you know, you can help once you get it set up and it starts doing its thing. You can help. You can be one to do breaths. You can be one to do compression, whatever it is, because it's going to tell you what to do. So that's the thing to remember. Once it's on and set up, y'all are good.
Step 2. Attach the AED pad.
So, you know, it'll have pictures on it, so it'll show you what to do. Let me get to the...
Step 3. Allow the AED to...
Yeah.
And what they talking about? When you
Step 4. Deliver...
The anterolateral, which you mean placing one right there.
So, you know, on the pictures, it shows you. So you got one that's right here,
right,
and then one that goes up here.
And that's the anterolateral, right?
Yeah, lateral is your side.
And posture is the one that's going one on your back.
Yes. So thing to remember, if you get ready to shock, you gotta say clear, so everybody backs up from the patient. You don't want to be touching it because you get shocked.
Step 5.
So
immediately restart chest compression.
Once it gives a shock, you're gonna start your chest compression.
Step 6. Repeat rhythm analysis
so
when prompted by the special
AED,
condition.
AED it's gonna be analyzing even while y'all doing chest compression. It's gonna be waiting. And then when it starts analyzing, it's gonna tell you. So it's trying to analyze to see if it can deliver a shock. So once it's on, it's gonna do its thing. You don't have to do anything else to it. Only thing you're gonna have to do is press the button when it tells you to.
But then since it's gonna tell you when it's dead, like.
Well, it's gonna say no shock detected, and you probably won't ever get a pulse back either. So.
Special conditions that do not require additional action.
Hairy chest. You know, I've told y'all before. If you don't have anything, they're not sticking, take 2 pads, rip off the hair so you can place the pads. If they have a pacemaker or any kind of device, you want it in the vicinity of where it's supposed to go on the picture, but don't stick it like right on top. But you'll see somebody that has like a pacemaker. You'll see something sticking out. Yeah.
Where would you stick it? Like right there?
Just close to, but not over it. Just somewhere in the vicinity of where it goes. Transdermal medical patches. Those are like pain patches or like nicotine patches. You'll take it off, wipe that medicine off. Make sure you wipe the medicine off. You don't want to put the pad on top of that. If they have water on their chest, wipe off the chest because you know this is an electronic device. So flammable. You probably shouldn't. You shouldn't.
I don't even try it.
Yeah. Special conditions that do not require additional actions are pregnancy, a victim on a metal surface, and jewelry or body piercings. In case of jewelry or body piercing, these items do not need to be removed. However, avoid placing the AED pads directly over any metallic items. I don't know why you will be way up there, but
hair on chest.
This is just going through what I just said.
Pacemakers or inflated defibrillators.
Like, you know.
A victim may have a pacemaker. Transdermal medical patches. Transdermal medical patches are patches on the surface of the skin. These patches can interfere with the delivery water covering the chest.
Like a nicotine patch. You'll wipe the water off.
Flammable material nearby.
You don't want to use it near any flammable liquids, combustible materials, or gasoline, free-flowing oxygen.
AED maintenance.
And then you do have to do maintenance on them, like battery check, calibrating sometimes, making sure it has supplies, because you can make your own little kit that goes with it.
Lesson summary. In this lesson.
All right. Y'all got any questions? I didn't put nothing about opioids on there, so about drugs.
You got posted today?
What? This?